Today, my guest is Dr. William Moorhead, and he teaches systems and strategies for overcoming challenges in dental offices. He is affectionately referred to as Dr. Checklist, and he speaks across the United States. And I am excited to speak with him today. We're going to talk a little bit about anxiety and whatever other wisdom he can share with us that he sees helpful. So, Dr. Moorhead, thank you for being on the podcast and sharing this information. And I'm excited to chat with you today.
It is absolutely my pleasure.
So tell me a little bit about how you got into dental industry and what you're doing now.
Two absolute opposites. When I was 8 years old, I was so blessed to have such great parents that were so supportive. I've been a musician since I was 6 years old, piano and keyboards. I got to take 12 years of lessons from my grandmother. My mother was a fabulous cook, but there were a lot of sweets in our house. And I had a sweet tooth, and I still have a sweet tooth. I cannot get past it. My parents took me to the dentist regularly from early on. Still didn't learn to floss until I was like 20 or something. I'm older than I look too. That is part of the perspective here. Anyway, back in the 60s, medical training in dentistry wasn't what it is today. And I had lots of allergies. When I had decay in several of my permanent molars, the dentist told my mom it wasn't safe to numb me up because I had lots of allergies. Now, I know now that that is extremely rare, was extremely unlikely. One of my earliest experiences in the dental office is hanging on for dear life to the arms of the chair while the dentist drills and the flashes of pain going across my face. That is not an inspiring way to want to get into dentistry, right?
No, it's not.
I also, though, can remember sitting in the dental chair. This is a really odd story. I don't think I've ever shared this with anybody. I'm sitting in the dental chair and all these knobs on the dental unit. I wanted to know what they did. Weird kid. Anyway, going back to the original, though, going into dentistry has allowed me to be able to help others like me that had the bad experiences. It didn't just affect me in dentistry. I can remember at one time passing out when I was in middle school from having my blood pressure taken.
Oh, wow. I had a similar story with being scared as a child and a doctor who would do hand over mouth. And not use anesthetics. So it must have just been the 60s with some of these doctors, but that is crazy how you get into it. Same thing. I went into it because I had a fear. I had stains on my front teeth. I was bullied. And so it's interesting, like how people's origin stories and how they get to where they are. Things that happen and trauma. So that's where anxiety and fear come in, and it's real in the dental office. Now, a lot of it too has to do with the fact that they can't breathe when they lay back, and we're not even taught to address that in the dental office or look at that with anxiety and fear.
I'm glad we're learning those things now, but it's taken a long time.
It has. But how did you end up talking anxiety and fear, and did you just continue that on from your experience as a child that you wanted to start talking and teaching about that?
I didn't ever even think about talking and teaching for a long number of years. I've been in practice 43 years. If you do the math, that makes me 37, okay?
Okay.
Anyway, I've only been speaking for about a decade. I was privileged to be able to serve the dental community as president of my state dental association in Kentucky like 13, 14 years ago. I had before that, when I was in that track to get up to that position, become a meeting planner. For those of you that are not in dentistry, a meeting planner is one of the people that goes to other meetings and scouts for speakers of good quality to invite to our own meeting. And as I watched other speakers, and then I got in front of groups with my dental association speaking, I kind of got the speaker bug too.
And you were very good at that. I enjoyed your speech. We met a few weeks ago in Key West at Dentistry's Got Talent, which is one of the reasons that I wanted to interview you today, because you are definitely a wealth of knowledge. So let's talk a little bit about anxiety and fear, and maybe what questions patients can ask dental offices to alleviate some of that anxiety before they even make an appointment.
It never hurts to look at Google reviews to see when someone has taken special care of a patient and looking for things like they listened to me. Dental offices are busy places, and some offices have learned, despite the busyness, to make the time to listen to the patient. And if we listen to the patient, I teach dental professionals to ask open-ended questions so the patient is brought out, especially if they're anxious. But when you're talking to the dental team early on, if you can be open about what things bother you, what your triggers are, so that they can be able to help you. If they're not forward about it, ask for ways that you can let the dental professional know my signal is a hand up. In fact, when I'm even doing an exam on a patient, and I'm doing it on a patient that has shared with us that it's not their favorite place to be, I prompt them to put that arm up before I lean them back in the chair. And I tell them, I know that if the arm goes up, it means I stop first and then I ask questions. I want them to know they're in control. Feeling a level of control is very powerful when you feel that you're in an anxious situation.
I think it's great that you speak about that. And I know my mom didn't go back with me because she had anxiety and she was worried that it would cause anxiety with me too. So I think for parents that have anxiety, it might even be better for them to not go back with their kids. How do you feel about that?
That can be true too. When I first practiced, and for years, we just blanket didn't allow parents back. And it can be very useful to have a parent back if they're supportive. But you're right. There are some parents that just can't handle it and make it worse. In most families, there's two parents. Sometimes if you need a parent there, you've got a choice to.
Yes. Which parent should go back? Draws,
Yeah.
which one? Yeah, that's a good thing for parents to know also. What is their anxiety level when they're bringing their kids to the dentist? So what other things should we talk about when it comes to anxiety and the dental office?
On the patient end, knowing the possibilities that are available for the dentists. Let me back up. May I go off topic and then come back to that?
Yes, absolutely.
American Dental Association statistics tell us that 1 out of 3 Americans completely avoid going to the dentist. So this is a huge group of people. And if you're listening and you're one of those patients, you're not alone. And again, some dentists, including myself, market for helping dental fear patients. My goal, I was one of those fear patients, and I know what it's like to be in that chair. Some offices are too busy to handle it. And when both of us grew up, there was so much need in dentistry that the fearful patients were a fringe, and nobody concentrated on them. Now, with that said, if you're a fearful patient or you've got a child that's a fearful child, when you find the practitioner that will cater to those needs, there are some good tools that are available. Nitrous oxide has been around for a long time. Nitrous oxide gas, laughing gas. It gets that laughing gas name because if the concentration is too high, it makes you uncontrollably giggly. On the positive side, if that happens, the gas is very easily titrated, and just turning it down to the proper concentration, within a minute, that's gone. So don't let that let you be anxious. Nitrous oxide, I find, is good for mildly anxious patients, maybe even the half of the moderate, the bottom half of those, it can be very helpful, but it's not a panacea. I do IV sedation. You see the logo up there. I teach other dentists to do IV sedation. There's only a small percentage of general practitioners that know IV sedation. Why? Number one, it either requires a residency or it requires the dentist to complete a certification that requires about 90 course hours. It's a pretty good investment. And for the dentist, it is expensive. The training, I'll admit, is expensive. The equipment to be able to do it and the emergency drugs are expensive. On the plus side, dentists that are trained in IV sedation are extremely well trained, not just in anxiety control, but in medicine and in medical emergencies, and are well equipped to handle things if things don't go perfectly. When I train other dentists, we drill them on scenarios and things that can possibly go wrong. Kind of like when airplane pilot knows how to be able to land their plane with the landing gear up. It's because that pilot has gone through scenarios, has gone through simulations. We teach our dentists to do the same thing. There's another tool that I use in my office. Think about headphones with synthesized music. The product is called NuCalm, NuCalm. It was originally a medical device. When I bought it, it was like almost $5,000. And it's very affordable now. And not just medical professionals use it now. They make neuroacoustic software with the NuCalm brand, for instance. There's others out there, but NuCalm is the best developed. They make programs that will help relax, help concentration. Their rescue mode, that was their original, it puts the patient in a REM state to go into the way that our fight and flight response is. There's the fight and flight response called the sympathetic nervous system response. And then there's our calm side, the vagus nerve, the parasympathetic system. And without getting into a bunch of science with it, the NuCalm, it hijacks that parasympathetic calming system and it induces calm. And one of the neat things is it can safely be used with nitrous oxide. And for dentists that don't know IV sedation, it comes reasonably close to moderate sedation and the patient can still drive themselves home.
That's awesome. So it's kind of like putting them in a hypnotic state almost a little bit.
Almost, yeah. The patient still has control. Ideally, if they can tolerate it, there's a mask to shut out signals of what's going on. There's the noise canceling headphones. And one of the triggers for a lot of patients is the drill, what we call the handpiece in the dentistry.
Right.
And so the noise canceling headphones also drowns out that.
That is awesome. And something that moms need to know too with nitrous oxide, if your kids have the MTFR gene, nitrous oxide is not recommended for your children. So that's something that I think is important to know. And not everyone knows if they have that or not, but it's contraindicated with nitric oxide.
But on the positive side, it's so easily reversible. If you find out there's an adverse effect, you shut it off. It's all gone in a minute.
Yeah, that was like my lifesaver when I was a child. I remember that the pediatric dentist that I ended up going to after the bad experience, he had Dumbo around the room. So when I was on nitrous oxide, it looked like the Dumbo was actually flying. I remember that as a child. So it's funny the memories that you have.
Sure, Dumbo wasn't really flying.
I don't know. He might have been really flying. And IV sedation is definitely something that is being used more. And a lot of times people don't want to put their kids under or even their pets under. I know I was talking to my girlfriend about this, but it is an alternative, especially if you have dental anxiety. And if you have a child that needs a lot of work, you can get it done all at once versus bringing them back and forth. So IV sedation is really a great option.
Let's talk about kids, okay?
Okay.
Kids, their airway is more complex and more difficult to the tune of, if you don't have the proper training and the proper emergency backup, it's easier on a child that is being fully sedated, as in moderate sedation or deeper, to wind up losing the airway and having a catastrophic event. So regulations in all states require special training for dentists that are working on children that are under 13 years old. I don't do that type of sedation. And more of it is being done nowadays in the hospital setting, where there's someone to be able in an emergency to intubate and not have a catastrophic event. Now, on the positive side, in my dental treatment rooms, in dentistry we call them operatories, but I don't call them that in front of patients. In my treatment rooms, I have a television directly over the patient. And when the child is on nitrous oxide and the headphones with the TV are on, it also has a magic effect. I rarely find the need to send a patient to a pediatric dental office for sedation because of just that slam dunk of the cartoons on the TV and the nitrous oxide.
And then do you put the noise canceling headphones on the kids then too, or?
But it's generally the TV, not the NuCalm software.
Okay, got it. Well,
That tends to hypnotize them.
yes, it does. That is true. We had a TV in our repertory, and you're right. That is awesome that you offer that. So, what other advice would you give to people that have anxiety going to the dentist?
Well, we talked about researching before you go. We talked about opening up to the dentist. We talked about the tools available. For me, it helps just not to dwell on something. We tend, if we're anxious about something, to just dwell and dwell and dwell. So if you can be able to trust enough to leave it until you get there, I think it helps. You don't want to be doing things like self-medicating with alcohol, with your own Valium cousins that the dentist doesn't know for. That can be a recipe for disaster. I have never been a recreational drug user. I'll say that up front. And I know cannabis is getting more and more popular in our country now, but cannabis use in patients that we're going to sedate, to use IV sedation, I can't get those patients as well sedated because of their cannabis use. And we're asking them to avoid it completely for 3 days before. I've not seen any studies to know how cannabis affects nitrous oxide, but from what I know about how our body works, I would suspect similarly it could have a detrimental effect. I've not seen any studies. That would be an interesting one to research.
That is, and that's another good point you bring up, because a lot of times when I ask patients about their medical history, they don't really think that we need to know that. You're just cleaning my teeth, or, you're just working on my teeth, but it's all connected. So even though our mouth has its own insurance from our body, it's connected. So we really need to know what your medical history is, what medications you're on. If you're not sure, bring a list with you to the office, because I know that the mindset is, why do you need to know that? You're just working on my mouth. But it's not like you're just giving us your teeth. It's all connected to the rest of your body.
You mean they can't drop their teeth off and let us work on them and then pick
Some
them up?
people can, but not most of them.
Ooh, okay, let's not go there. This is not about dentures.
Yeah, so I mean, it's important. I see that probably 50% of the time people just give me a look or think, do you really need to know that? What does that have to do with anything? So it is important that your dental professional know what you've taken, even down to supplements.
It has gotten a lot better. When I started practice, it was a lot that was common. Maybe it's because of my area of expertise and the reputation has caught on that people more trust us when we ask that, but we do still occasionally get it as well.
Yep. So let's talk a little bit about what you do with checklists for other professionals that might be listening, because I know that that's really interesting, and systems are definitely important in order for things to run smoothly. So tell me a little bit more about what you do with that.
I teach dentists to use the concept that aviators use, and we talked just briefly earlier about the pilot that has to land and the landing gear is up. Almost all of those times, it winds up going well because the aviator has ahead of time done simulations and they have checklists. I got in a Southwest cockpit one time 8-10 years ago between flights. It was one of the Southwest flights where it's going to land and then continue on. And so I was stuck on the plane. And when everybody got off, I asked if I could get in the cockpit. Now they thought I wanted a photo op. I wanted to see the checklist book. I had an event in my office back 15 years ago where an elderly patient, I gave a tiny dose of the drug Versed, midazolam. It's a cousin to Valium. And we're taught with older adults that they're more susceptible and to go really slow when we give those things low dose because it can affect them more. Well, long story short, I gave a tiny dose to a 72-year-old man, and his breathing just slowed way down. But I'd seen this before, and I tipped his head back like we're taught in basic life support, and I reached for the oxygen. The oxygen didn't come on.
Oh.
And what I know after the event was someone had left the oxygen on after inventorying it on the Friday before, and there was a half of a large tank of oxygen that could have lasted for a week and a half. But they left it on, and someone else left on the oxygen in the treatment room, and it drained it. And
Oh.
worse yet, someone had done the same kind of thing weeks or months later, and nobody caught it to the emergency oxygen. That was a wake-up call then, because number one, I panicked. Everything worked out okay. I got my act together within a minute and a half, and I was able to give a reversal agent. The patient was fine. But I realized then that we had to do something different. We had to figure out some way to be able to have predictability and safety. And that's when I found the aviators concept. I had not read it at the time. In fact, I developed some checklists for several years, and even a dental software product that's checklists for running dental office. It's called StreamDent for the dental people in the audience. But I developed a bunch of checklists for running a dental office and never got a hold of a book by a surgeon that headed the World Health Organization, the WHO, back about 2005 to 2008, I'm guessing. He wrote, the author was Atul Gawande, US born, and he wrote a book called The Checklist Manifesto. And it's not this nerdy book about how to write checklists. It tells stories about how checklists have changed the way of thinking. And he revolutionized medicine with operating rooms, emergency rooms, not just in this country, but worldwide, where he was head of the World Health Organization. For instance, if you go in and have a blood test, and blood tests are one of my triggers too. I told you about my past experience as a child. When I have a blood test, I have to have them lay me down so they won't have to pick me up. That's a sympathetic response. I do a lot better than I used to, but I still have them lay me down so it won't happen. But anyway, when you go in for a blood test now, when you go into the clinic, the hospital, whatever, I go to the local small hospital just a half mile down the road from my house. They put an armband around your arm like it used to be that they only did if you were being admitted to a hospital. You get into the lab where they're going to draw blood. They've got the paperwork. They ask you your name and your date of birth. They're checking to see that their paperwork, that the armband, that the labels that they're going to put on your vial all match. That's an example of using a system, a checklist approach to error-proof the process. I had a kidney stone back in April, May. Not a pleasant experience. I do not recommend that if you have a choice.
No.
And when they were taking me back to the operating room before they sedated me, they asked questions to make sure they knew exactly what they were doing, and it all matched the paperwork. I didn't have to have a kidney removed, but if they've got to remove a kidney, they've got to do something that's a left, right. They will write on the patient's skin which side it is, little things like that to error-proof the procedure. In dentistry, we've been slow to be able to grasp the advantages of checklists because we've got this mindset, dentists especially, that it's a pride thing. You got to keep it all up here. Aviators don't keep it all up here. They know it, yes, but in an emergency, the fight or flight response kicks in and we don't think clearly. And we're all human. Even if it's not an emergency, we forget little things, and those little things catch up with us. And by applying the checklist approach, before I pick up the syringe and I'm up the patient, I automatically look at the patient's chart. I look at their health history. I make sure that there's nothing that I need to know special. I look at the x-ray to know that the planned procedure, and I check my previous diagnosis so that before I start the procedure, with that timeout, I've got all my ducks in a row.
Yeah, I think that you're right. It does make a difference. And when different people are doing the job, you know that everybody's doing the same thing. So checklists, I think, are definitely very helpful in any business, I think, not just
medicine or dentistry.
Yes, absolutely.
When I'm doing my elevator speech, I say, okay, you got on the plane and you found out that the pilot and the co-pilot were too busy to run the safety checklist. You hear the flight attendants talking, do you want to stay on that plane? No. But that's how we run businesses every day without a safety net.
Yes. If people would like to get a hold of you and find you, how can they find you?
Doctors that are interested in learning IV sedation, myself and my business partner that run the program is IV sedation training for dentists.com. for dental professionals that are interested in not having to continue to suffer the problems of dropping the ball all the time and want their offices to run more smoothly with the dental checklists. That's StreamDent, STREAM dent.com. My email is dr.m, like Dr. Moorhead, at streamdent.com. And if anybody sees this and would be interested in scheduling me as a speaker for their meeting, it's drmoorhead.com, and Moorhead is spelled like you don't have a chance, but you see it on the screen there in the bottom.
And are you still practicing dentistry?
I am 4 days a week. I would be bored if I had to sit at home. I love dentistry.
And where do you practice? In
I
Kentucky?
practice in rural Kentucky. It's a small town of 3,000. I tell people it's not the middle of nowhere, but I can see it from here.
What would be the last piece of advice you would give?
Listen to your patients.
I love that. Thank you so much for being on the podcast and sharing your information. And I appreciate you and look forward to working with you soon.
It has been a delight. Thank you.